at the Odette. Thank you all so much for being here, for attending this presentation. I'm so happy to be here and to share some of the work that I've been doing so far. So let's get started. I was thinking about trying to explain a definition of art therapy. So on the screen, you'll see this is a definition from the Canadian Art Therapy Association. But when I was thinking about my own terms of explaining art therapy, I started thinking about art therapy being like any other therapy that aims to support people through emotional and psychological difficulties. Art therapy sessions are typically geared towards achieving therapeutic goals, but the unique thing about art therapy is that clients can harness the creative power of art and making art. It's interesting because art is like a wordless story. It enables people to express themselves and often define things that they couldn't put words to before. It has a healing and therapeutic quality, and we can use the value of art expression as ways to learn more about ourselves and as a way to improve our sense of well-being. Research shows that making art has positive effects on the brain. It induces relaxation and also accesses parts of the brain that hold trauma and stress in different ways than verbal therapy can. Art brings about creativity, and creativity brings about hope and possibilities. So the focus is on the process itself and not the art making. It doesn't really matter how good you are at art or making art. It's more about the way it makes you feel, the process of making it, and the insights that you gain from the creation process. It's a language of self-exploration, and it can reveal things even in the line and shapes and colors that you use. So generally, we don't make judgments about people's art. Rather, what we're trying to do is encourage clients to explore their own internal state through art making, to reveal things that make sense to them for their own meaning. And one of the important things to note is to work as an art therapist, you must have a master's degree or an equivalent and must be a registered psychotherapist. Following qualification, art therapists are required to continue their education through continuous professional development. So we've done a little bit of research here, and I've got some of the citations just listed. A lot of the research that has been done in the effectiveness of art therapy in cancer care, particularly over the last 20 years, shows the therapeutic benefits of art therapy. I've highlighted some of them here. There's 3 studies in particular that I'll be looking at. The first one pertains to I guess, measure whether art therapy could improve the physical, mental, and emotional well-being of patients with cancer. The second study in the list focused on evaluating the effectiveness of art therapy on cancer patients' quality of life, physical and psychological symptoms. And then the third study here, this looked at measuring the general impact of art therapy on the symptoms of cancer. And in the following slides, I'll share some quotes.
Oh, no, Preet. Oh, hi.
Hi.
I just realized I was unmuted. I'm so sorry.
That's okay, no worries. So I'll share some quotes from the research papers on the following slides that highlight their key findings. So I'll just give you a couple of seconds to, read the quote. I'm sorry, I jumped ahead. And so most of the research done in art therapy for patients with cancer focuses on art therapy as a complementary support to medical oncological treatment, such as surgery, chemotherapy, and radiation. And so in this study, 50 inpatient participants were recruited from an oncology unit at a medical center over a 4-month period. They participated in multiple 1-hour sessions of art therapy. The researchers conducted pre- and post-art therapy symptom screening tests to measure symptoms including pain, tiredness, nausea, depression, drowsiness, anxiety, appetite, well-being, and breathlessness. And so in this study, researchers found that there was a decrease in most symptoms as a result of art therapy. One particularly surprising finding of the study was the reduction in tiredness, and this was expressed by the subjects in the study. This was the first study to document reduction in tiredness as a result or as a direct result of art therapy, which I found quite fascinating because I've not seen this before. This second study, I'll give you just a couple of seconds to read this. So here, 50 participants took part in this second study, including patients with breast cancer, gastrointestinal cancers, and hematological cancers. They were all assessed pre and post treatment, just like the previous study, for pain, emotional distress, depression, and anxiety. And as the quote outlines, the researchers concluded that art therapy significantly improved all measured symptoms among all cancer patients. And this is the last study. I'll give you a few seconds just to read this quote. Oh, and RCT stands for randomized controlled trials. So this third study consisted of a meta-analysis that examined 12 separate studies involving a total of 587 patients with cancer. The overall findings were similar to the previous studies and found that overall art therapy had a statistically significant positive effect on patients' quality of life, anxiety, depression, and fatigue. So a little history about art therapy at the Odette Center. So the program initially started in 2014 as a result of a patient who was here. They'd undergone treatment and were interested in providing art therapy programs for patients. The program started initially for 2 days a week, but it only took place in the waiting room. During the pandemic, this program continued, but it continued virtually. So it was only 1 day a week, I believe, for about an hour in the afternoon. Once the pandemic ended, I came into the role and we started art therapy in the waiting room again, which unfortunately wasn't very successful. We spoke to some of the patients to get some feedback, and they reported heightened feelings of anxiety and stated that it was just too overwhelming. We even set up a table outside of the Pearl so that patients could hear their names being called for appointments, but it just didn't seem to work. The anxiety was just too high and we had very few participants, if any. So with the support of Kirsty Wield, who's the patient care manager at the Odette in the cancer clinic, we started art therapy inside of the chemo clinic, almost like a bedside art therapy model. Patients were much calmer knowing that their treatments had started and were able to participate. Right now, the program is still 2 days a week, but this time we're focusing just inside of the chemo clinic. This program is funded by the foundation, and our goal is to increase the number of days we provide this service so that we can reach and support even more patients. So here's some of the clinical nursing team. You have to ignore the outfits and the, I guess, headdress. This was a Halloween photograph that we took, so they don't usually dress like this. There's a team of 31 nurses in this clinic. Many of them are great advocates for art therapy, which is such a blessing. Most will proactively introduce me to new patients as they come around. Some nurses will go out of their way to explain what art therapy is to their patients and will let me know if they have anyone that they think would be interested in participating. which makes my job a lot easier. And the feedback from the team has been phenomenal. One of the nurses said that she was really unsure about the art therapy program at first, but she's seen the benefits of it and how it's helped patients. I remember one of the nurses called me in when a patient was very emotional. She introduced me to the patient and explained my role, which gave me then an opportunity to help in ways that wouldn't have come my way otherwise. So I'm very, very grateful to the nursing team for welcoming me, for taking an interest in the art therapy program, and understanding how it works and how it can be very beneficial. So we've been really fortunate to have a physician by the name Dr. Oliver in the AYA, which is Adolescent and Young Adult Hematology Unit. He's referred some patients to us. So currently we're accepting referrals for the inpatient population. And if you'd like to send a referral for either inpatient or outpatient, you can email me directly. So I know it's Monday, and Monday's always tough. We've got a few statistics to get through. So for those of you who need a snooze, you'll probably have about 3 or 4 minutes, and then I'll wake you up at the end. So far, I've facilitated a total of 292 art therapy sessions since March. I've met with 147 female patients and 29 male patients. So that works out to be approximately 85% female patients and 50% male patients. This was interesting to me because while I don't have access to formal data about the patient population at the Odette Centre, as I'm only there 2 days a week, I would say that it is probably closer to 60% female and 40% male based on my observations of the 2 days that I'm there. This statistic seems to show that a smaller proportion of male patients are currently engaging in art therapy at the centre. And what makes this even more interesting is that the second graph, here we go, shows that while there are fewer male patients that engage overall in art therapy, those who do engage are statistically more likely to return than female patients, which is the complete opposite of what I thought it would be. So I've seen 9 male patients return after their first session, which is nearly a third of all male patients, but only 38 females have returned, which is around a quarter of all female patients. So this suggests that if we can find a way to engage more male patients, hopefully they'll find the experience valuable enough to come back for more. Okay, statistics over for those who are sleeping. So I just wanted to show you some of the artwork that we produce. One of the major, I guess, outlines for us is that we look to create work that avoids stress and anxiety. For this reason, the following slides showcase no-felt art projects, which is what we specialize in. We don't sit there and ask people to produce a Monet. We also tailor the program to accommodate specific needs for this population. So for example, we ensure that none of our materials have strong odors. We don't use paint or glitter to ensure that our clinics are always kept clean and hygienic. We also wipe down all of our materials in between interacting with each patient. So the images on this slide show some journals that patients have made. Some of the patients have used these journals to document health data, to write down medications, and notes from their chemotherapy sessions, and some have just used them as a chemotherapy journal. One of our most popular activities has been bracelet making. We've been really fortunate to have some beads donated to us, including a whole box of Swarovski crystal beads from one of our nurses on site. Some patients have used these beads to make prayer beads for themselves. Some have made gifts for people that they feel that have really supported them through their journey, whether it's friends or family members. Others have made something special for themselves on their last chemo session. So we've had lots of different types of beads, like mother-daughter beads, family beads, sister beads, almost as if to say we're in this together. It's funny because a patient told me last week that they were reminded of the lovely time that they had at one of our art therapy sessions every time they looked at their bracelet. One of the great benefits of these activities is the focus on mindfulness they provide, as well as the more specific benefit of providing a distraction from chemo treatments. So many of the patients have mentioned how fast time has passed and what a great distraction art therapy has been for them. Others have said they were having so much fun they actually forgot that they were having chemotherapy, which was music to my ears. So through these sessions, we've been able to create community within the treatment quads, spark meaningful conversations, and help people share their cancer journey with maybe their neighbor who's in the chair next to them. It's been really helpful because a lot of these patients report how lonely this journey has been for them. And sometimes we'll have someone who's participating in art therapy and they'll look over to their neighbor because the clinic is set up in little quads, so there's 4 people in a quad, and they might just spark a conversation with their neighbor just to say, look what I made, and it starts a conversation there. We start to create a new community. And when we look at this screen, the image underneath the title, I don't know if you can see my cursor, but it's of 2 people holding their hands together. It's kind of fingers intertwined. This is an example of one of the things that I mentioned, which was mother-daughter bead. So here we had a younger patient who came with her mother, and she was having chemotherapy. And just being able to do something together that was meaningful for them, you could just see the impact that it had on the 2 of them. The image above that and slightly to the right, we had a female patient, fairly young, who was having chemotherapy and wanted a bit of a distraction. She came with her husband. They decided they wanted to make family beads, and they had a young child who was at a daycare. So I think it was a toddler. They wanted to make beads for their child. So they all had beads. And again, it just shows that togetherness, that people are looking for connection. And underneath that, we have another image here. This was a very young patient who was, I believe, 19. Every time she would come with her 2 sisters, her mother and grandmother, and they'd all wait in the waiting room. We can only have 1 person come and sit beside a patient. So they would take it in turns and come inside and we'd make bracelets together. And by the end of the patient's treatment, all of the sisters had about 3 or 4 bracelets. The grandmother had a bracelet, the mother had a bracelet, and it was just a bonding moment for all of them to kind of share. And I remember at the end, the very last treatment for this patient, the mother came in and she gave me such a big hug and said, do you know what, Preet, you've made this journey really easy for us and we can't thank you enough. She said, it's funny because whenever the girls get into the car and get ready to come here, all they talk about is, I wonder what Preet's going to have for us today. And so they were very, very grateful. We have another mother-daughter bead at the end of this screen, and the patient brought her mum in to support her, and they wanted matching bracelets, and they said they would wear them for every single treatment, which they did. So yeah, it's a lovely, lovely thing to experience. And the beads continue. So while bracelet making is typically something that the female patients participate in, and it's very easy for them to participate in, a small percentage of male patients have also participated in this activity. I find that with men, they'll typically look for wooden beads, which I know I now have plenty of. In fact, I've had male patients ask me if I had any man beads, and they were really happy to see that I did have man beads. And I didn't actually know what man beads were until I met some of the patients and they explained them to me. So now I have a whole box dedicated to man beads, which is quite cute. Another type of art project that we've done are these laminated sheets. So a couple of months ago, Kirsty approached me and asked if I could add some art to the windows. Currently, we have origami patterns on the windows, but they've been there for several years and some of them are looking quite tired. So she specifically stated that whatever we were to create couldn't block any light. I went away and I thought about what I could do. I immediately thought of sun catchers. So we ordered some dried flowers and purchased a small laminator to create these pieces of artwork. Some of these patients added words of encouragement or their favorite quotes to their design. And some of them placed them in the windows and others took them home. So I appreciate that the font in the first one is quite small, so I'll just read it for those who might have trouble reading it. There are friends, there is family, and then there are friends that become family. This particular patient didn't have much family around and was brought to chemotherapy sessions by a neighbor, and then that neighbor picked them up also. So she wanted to frame this and give this to her neighbor just to say thank you. The one in the middle just wanted something that was quite vibrant and didn't have a quote or anything, but just put this floral arrangement together. And then we have this one on the right, and the quote says, "Once you choose hope, anything is possible." And this patient wanted to leave this in the window to have other people look at something that was positive and hopefully uplifting. And we continue here. So I had a patient who was having difficulty when her hair was falling out. She was really distressed. And as you can imagine, it can be quite tough witnessing all the emotions that people experience during this time. And so my way to cope is to, at lunchtime, go for a walk or I go to the gym. On this particular day, it was an early autumn day, I decided to go for a walk outside. And during my walk, I thought a lot about this patient and ways that I could possibly try to help her. And as I walked, I observed the trees shedding their leaves, and they were gently falling all around me. It made me think about this patient and her experience. I decided to collect some leaves and took them back to the clinic. I shared my reflections with her and invited her to create a piece of art with the leaves. Together, we found a quote that resonated with her, and she decided to post this in the clinic for others to see and for them to gain strength from. Again, I appreciate the images are not very clear, so I'll just read this. It says, "If you feel like you're losing everything, remember that trees lose their leaves every year and they still stand tall and wait for better days to come." So that's up in the chemotherapy window. We had another patient who created this one, and it says, "Some days she's a warrior, some days she's a broken mess. Most days she's a bit of both, but every day she is there, standing, fighting, trying." This is another art project that we've done. This is all woodwork. Before we started the wood projects, I created a booklet called Words of Wisdom. And I wanted this to be a way to engage male patients. So this appeared to be a successful way to begin a dialogue and build trust. Many male patients were happy to talk about their life story and share their words of wisdom with me. So building on this, I started introducing woodwork, thanks to the help of Sue, who's our art therapist, and she works at the Veteran Centre Woodshop. These projects have been incredibly successful in bringing in male patients. And when we look at this, I think it's because of the tactile quality of the wood itself, which inherently feels more masculine or manly to several of the male patients than bracelet making would. In addition, the wood shapes that are most often requested are birds and homes, which I have on the screen. I think that this is because both forms are symbols that conform to powerful archetypes that many men may find easy to relate to. So if we think about archetypes, the archetype of the bird often represents freedom, a sense of not being held captive or contained, new beginnings and hope. And when we look at the house reminds me of the saying, "Home is where the heart is." And houses keep us and our loved ones safe. They are strong structures that outlive us and continue to provide for our loved ones, even when we're not there. So there's a story behind the House of Love. You can see the second image here. I had a patient who was very young, a 30-year-old male patient who is terminally ill. He has a young daughter who's a toddler, and he and his partner are quite worried about what the future holds. He decided he wanted to paint a house, and on the back of it, he wrote a letter to his little daughter. And on the perimeter of the house, he wrote the words, "I love you," and then his daughter's name on the side. So what we do with these art pieces is we laminate them just so that it keeps the color from fading, and it also gives it a really nice kind of glass effect. So this patient had written this letter in pencil, and he decided he did not want to put it in ink. So we we poured resin on the back of that so that it would stay and it wouldn't wear away. It would always be there for his daughter to read. Again, we've had lots of male patients use this house. I had another older gentleman paint this house, and it's the one in the picture that you're looking at right now. He had written initials or put initials inside some of the hearts for his children and his grandchildren. He also was terminally ill, and so he left some of the hearts vacant because he didn't know if his children were going to go on to have more children, and just left a space there for them. At this time, it was his granddaughter's 5th birthday, and he also wrote a letter to her on the back of this house. So as you can see, looking at these images, there's lots of symbolism and some subconscious expression in these pieces of art. We also had another patient, a male patient, who was always accompanied by his daughter. She would always be interested in participating in art, but I felt as though if I engaged her, it took her away from her father because her focus was on the artwork. One day I invited him to participate. He and his daughter both painted a mandala. At the end of the session, I explained that I would take their painted pieces and pour resin over the top, and they'd get them back during the next session. And when I saw them a few weeks later, the patient couldn't believe that he had produced the artwork. He wouldn't stop smiling, and you could see the sense of pride and achievement in him. He was so happy that he stood the art piece on the window next to the bed where he was having his treatment. And he kept saying to the nurses, "Can you believe I created this artwork? Look at my work. I can't believe I made that." And these are the moments I live for. Another art project that we've done are mandalas. So mandalas are known for their symmetry, and they represent harmony and unity. So we've completed many of these mandalas, and we use these jelly roll pens that give it a vibrant feel. We also use stickers to create the artwork. So it's a sticker template. And once we're done, we peel the sticker off, and it gives us this stained glass effect. So we've managed to get a bulletin board in the clinic, which showcases a lot of the patient artwork. And we've done these soul card making. This was introduced as a means to help patients connect with their intuition. It helps participants find ways to express emotions, feelings, and deep soul wisdom that they might not otherwise find a way to articulate or access. So patients were asked to select and arrange a series, like just random collage images, and then we just invite them to arrange them any way they like, but to do it intuitively without thinking logically about connections until after the collage has been assembled. Because the directive encouraged patients to bypass their logical mind, many of them noted that the collages became imbued with deep personal meaning as a result. So for example, the one under the title, a patient selected this image of the universe, and she wanted to write something about the universe having her back and that she was sending out positive energy. So we found this cutout of "We've got you." So that really resonated with her. We have another one next to it at the bottom right, "Take care of yourself," with this lady with a peacock on her shoulder. So we had a young mother who had 3 children, and she was finding it really difficult to make time for herself. She was always doing for her children and all those around her. So she said this was going to be a really good reminder for her to try to make time for herself. The one above it, Journey Together, we had a patient who was trying to find their inner strength. They saw this image of a fox, and it was almost as if kind of trying to find unity or community, or like being like a pack, as foxes usually are. So she found this text that said Journey Together, and that really resonated with her. The one that says Time to Bloom, a patient did that as they were coming towards the end of their journey and their hair started to come back. And so this image really resonated with them, and they wanted to see this as a reminder of what was to come, and just getting better and being well. But this is the bulletin board that I was talking about earlier. So we have some artwork up right by the reception of the chemo clinic. So I was reflecting on some of the outcomes and observations since my time here. And art therapy has been successful in providing patients with a sense of purpose and control. And we get that through choice making in the art process. So these qualities tend to be limited otherwise, especially within a hospital setting. Patients and families have regularly reported feelings of isolation during treatment, which I've mentioned previously. However, many of them shared that art therapy has been effective in reducing these feelings. And even among a diverse patient group with wide age ranges, educational histories, ethnicities, and diagnoses, most patients were very receptive to art therapy, and most stated that art therapy benefited their overall well-being because it distracted them and focused their attention on something positive. Art as a universal language transcends words. So it's got no language barriers. And I know that because I've facilitated art therapy sessions with patients who don't speak English. There's been a couple of times where we've used the art to communicate, or gestures. I've even had a scenario where I was working with someone and she wanted to get some clarification on something. She called her or FaceTimed her daughter. And so the three of us had a little art therapy session together, which was brilliant. And so on my cart, I keep feedback forms, and I also keep forms, permission forms to get people to sign so that I can share some of the artwork like I have done today. And sometimes I have patients that will just say, do you have a feedback form? I'd really like to give you some feedback, or can I contact somebody to let them know how much I enjoyed this? And so I'm sharing some of the feedback that we've received from patients. In addition to this feedback, some of the nurses have said that the clinic is starting to look more homely and less clinical with the addition of the bulletin board and the artwork on the windows. And so this is an email received from a patient. I won't read it out loud. I'll just give you a couple of minutes to read it, and it will give me an excuse to have some water. And so I feel very honored and very privileged to be able to work here and do the work that I'm doing. And I'd like to thank you all for being here and being part of this presentation. Thank you. Does anyone have any questions or any comments they'd like to share?
I have a comment and a question.
Yeah,
Hi, Preet.
hi.
Amazing presentation. First of all, it's really pretty impressive to see all the work that you've guided people through and continue to guide people through, and how they're responding to it in such profound ways. You made a comment when you were talking about the statistics that less men overall come, but of those men who come to art therapy, more of them tend to come back than women. Do you have any hypotheses about that?
Do you know what? I'm not too sure, Linda. I mean, I've only really started to look at the statistics recently as I was getting this presentation together, which kind of sparked all of this insight. I know initially it was very difficult, but I just do honestly believe that this would work. I get a lot of guys, like say, for example, I had a patient last week who was really interested in doing this bird. Um, but he did the bird within about 3 minutes and we spent 45 minutes talking. And I noticed that a lot of people are really looking for connection. And I don't know if this is just a stepping stone to having a connection. So he came in with an iPad and he had a nature documentary on. And as I approached him, I apologized for interrupting him, but I just introduced myself and some of the work that I was doing. And he said, sure, I'd like to participate. And I said, fine. He ended up being from the UK. We spoke about a few places that he'd been to, and he was just so excited to have the opportunity to share with someone some of his background, because I think he was saying, I haven't spoken about some of these things in 40 years. And at the end of the session, he proceeded to say to me, thanks for coming, but I did have this documentary ready and you ruined it. And so I laughed and I apologized. And he said, but I'm so glad to see you here. And he said, I'm back December 14th. Let's meet again. And so I don't know if it's that these pieces are a way of starting a connection, or if it's just people are very lonely and isolated and they want somebody to kind of break down this barrier and be able to sit with somebody and have a regular interaction. So I'm not really sure, Linda. I guess what I'm trying to say is I'm still navigating this, and I guess the next few months will try to shed some more light on this for me.
Yeah, great. Thank you.
Yeah, thank you. Okay. I'm not too sure who's facilitating this. And I guess if there are no more questions or comments,